Hi everyone, welcome. Do you want to know what specialty we have today? World Hepatitis Day. Today we will be discussing hepatitis in infants and toddlers. What is hepatitis? It is the inflammation of liver. In infants and toddlers, it is caused by certain type of viruses. The viruses like hepatitis A, hepatitis B, C, D and E. Hepatitis A virus is transmitted through fecal-oral route and also by contaminated food and water, also through transfusion. Hepatitis B virus is also transmitted through blood transfusion, but it also transmits when an infected person's blood enters to an uninfected child or infant or toddler. It can also transmit through sharp instruments or needle sticks, and also it can transmit through any sharing of personal belongings or things like razors or toothbrushes. Hepatitis C is transmitted when a baby is born to a mother who has already hepatitis infection. It can also transmit through blood transfusion. Hepatitis D is seen in infants who was already infected with hepatitis B, whereas hepatitis E is transmitted through fecal-oral route. In these different types of hepatitis viral infections, hepatitis A can cause acute viral infection, which has more recovery rate than the other types. The other types can cause chronic conditions that are a little bit difficult to treat and cure.
When a healthy liver is infected with these viruses, it will damage the liver cells and lead to a permanent liver damage.
What are the signs and symptoms of hepatitis in infants and toddlers? In infants and toddlers, we can see flu-like symptoms, fever, joint pain, tiredness or fatigue. They can have discomfort or stomach pain. They can cry frequently due to this discomfort. They might have diarrhea, clay-colored stools, dark-colored urine, and also in some babies we can see itchy hives on the skin. Hepatitis can lead to a very important condition or syndrome that is called jaundice. Jaundice can also cause due to other conditions. For example, neonatal jaundice. It can be caused due to vitamin D deficiency either in mother or in fetus. It can also cause due to the immature liver or premature labor of the baby. In this condition, most of the parts of the baby will be changing color. It is due to the accumulation of bilirubin in the blood. In a normal baby, the liver will take up all the bilirubin that is produced by the breakdown of RBCs, which is then passed to the bile duct and then to the duodenum. In a baby whose liver is damaged or has an infection, the ability will be less. Also, it can't take down bilirubin properly. It will increase the amount of bilirubin in the blood and thereby changes the skin color into yellow. This jaundice can be identified with certain types of tests. We can also identify this by an easy test, that is tactile blanching test. We have to apply gentle pressure 2 to 5 seconds over the forehead or the nose. While removing the pressure, we will be seeing a normal skin color in normal babies. Babies with jaundice, there will be yellow discoloration of the skin. You can check how babies will be appearing in yellow discoloration.
It can extend from grade 1 to grade 5, from face and neck to the full body parts including feet and hands.
How to diagnose hepatitis in babies?
It can be diagnosed by many tests like blood test, ultrasound, CT, MRI, liver biopsy, and etc.
There are several treatments available for hepatitis. Medicines are available for symptomatic relief and also according to the prognosis of the disease. Supportive care like diet and enough rest is required. In later stages, your health providers will suggest a liver transplantation. It is better for a prevention than cure. To prevent hepatitis in infants, it is better to keep a proper hygiene. It is better to avoid close contact with people who was already infected. It is better to take care of our babies' diet and food. It is better to avoid certain drugs according to the advices of the health provider. There is hepatitis vaccination available. Hepatitis A vaccination and hepatitis B vaccination. This can be taken separately or in combination. If the mother is infected, this will be taken by birth, like the hepatitis B. Hepatitis A and B also have 3 shots. Hepatitis A vaccination is also given by birth, and then the second dose by 1 month and the third dose by 6 months. It is 95% effective to prevent the disease. Hope this video is helpful for you. For more informational videos, stay tuned. I wish a healthy life for your babies. Thank you.
Dr. Mom.
Super